Okay guys, continuing with the cardiovascular system pathology, the lecture now, AV nodal bundle, and this is also called junctional premature beat or junctional beat. If they become multiple beat because of AV bundle and AV node, then they can be called junctional rhythm. So now we are talking about a premature beat that got created by the AV bundle or AV node. And again, why did this happen? Either you're giving too much drugs that are affecting the AV node, maybe antiarrhythmics, maybe you're giving antibiotics like fluoroquinolone or erythromycin, that causes. Maybe you're giving too much of lidocaines and those kind of things. Maybe patient is taking too much caffeine or nicotine or is under stress, or there is an ischemic problem and there is a calcified plaque somewhere nearby, or there is some infarctive tissue somewhere that is irritating it. So all those things that we talked about, any one of them can trigger the AV node and the AV bundle to generate a premature beat. Now this is interesting. I don't have an ECG for this to show, I'll have to draw it here, but this is interesting. Look, now the focus, ectopic focus of the extrasystole is sitting here. So let's say it is here. This is the area that got irritated. This area is now going to create what? It is going to send impulse into the ventricle, so that is going to create a QRS complex, right? Will this generate a P wave? Will you see a P wave? Many times no. So you should now fight with me. You should say, dude, this pulse has to go back to atria. Atria has to have a contraction and that should produce a P wave. So I'll give you two answers, yes and no. Depends where the depolarization happened. Remember this, that the AV bundle is a one-way street. It brings impulses forward, it doesn't bring them back. So if the irritation of the bundle is here, do you think it would go backwards? No. So there will be no P wave, although there will be a QRS complex. So if I made that ECG over here, let's say this is normal, P wave, QRS complex and T wave. After that, we want one more QRS complex without a P wave. So here, no P wave here, no P wave here at all, no P wave. Why? That means it is happening somewhere in the AV bundle, not in the AV node, and it cannot go backwards. The signal cannot travel backwards. Okay, now tell me if it was happening somewhere here in the AV bundle, then where would be the P wave? Here it has a chance to travel backwards. Then look, if it is traveling in both directions together at the same time, it's going to create QRS complex and P wave at the same time. Then can I say, if this is normal, QRS complex, T wave here, next QRS complex and the P wave are together over here. Why? Because it started from here and both of them occurred together. So P wave is superimposed on the QRS complex, or QRS complex is superimposed on the P wave. Interesting. P wave may or may not be seeable. So you may be able to see it or you may not be able to see it. So that is the quality of the junctional premature beat or junctional beat. If this happens again and again, then this would be called junctional rhythm. Do you do much about it? Normally, if it is just one beat or two beats, you won't even know. Patient would just come back and say, I had anxiety, I had a palpitation, I felt my heart was beating fast, and then you do the ECGs and everything, normally things would come back normal. So again, don't worry too much about it, but once you start going downwards, there is cause to be concerned. Cool. So that is what we have. Thank you. Like this video and smash that subscribe button as well, and make sure that you hit the bell button and get the notifications for the new videos in the future.